Hi everyone. For this anatomical model, I will go over some of the arteries and veins throughout the entire body, starting with the head and neck area. So first you have the internal carotid artery right here going towards the internal parts of the brain. And then you have this one as the external carotid artery going towards the facial area, which will eventually become the facial artery. What before the split of the two here is then where you have the left common carotid artery. Left common carotid artery, because if you remember my previous video from the heart, you have the aorta right here, and here are those three branches with the B, C, and S. B for brachiocephalic trunk, C for common carotid artery, S for subclavian artery. Okay, so this is then your left common carotid artery, and here is your left subclavian artery. Here's your right subclavian artery, and this little chunk right here is the brachiocephalic trunk. Then for vein, you have internal jugular vein, brachiocephalic vein, which is this whole section right here, and then you have the left subclavian vein. Okay, oh, excuse me, the right subclavian vein right there. Okay, so make sure you don't mix up right and left. Your right is the patient's left, your left is the patient's right. Okay, and then moving on into the chest area, you have the ascending aorta portion of the aorta. This is the aortic arch, and then you have that BCS I was talking about. Pulmonary arteries are those that are going away from the heart into the lungs to pick up oxygen. So these two right here are the pulmonary arteries on the left side and those on the right side. They're blue because they are deoxygenated coming back to the body, to the lungs to pick up oxygen. And then you have axillary artery, which I usually arbitrarily say around here. This is kind of a weird model where you can't see the armpit of the individual, but I usually point up here for subclavian, right under the clavicle, somewhere here for axillary or axillary artery. And then you have brachial artery. I will put it further down around the arm area. So they kind of merge into each other like that. Okay, you have again subclavian, axillary, and then the brachial artery. Then for the three arteries down here by the lower arm area, it is easier to look at this side versus this side because they kind of twisted the palm here. So here on this side, you can tell the side going towards the thumb. This outer red one is the radial artery. Then the other one going towards the pinky side is then the ulnar artery. And then you have this big red one right here is the abdominal aorta. This whole area, red is the abdominal aorta. You also have the thoracic one, but you can't really see it with this particular model because the heart is hiding it. Then on the abdominal aorta, there are three connections. One up here, one right here, and one down here. So usually I abbreviate it as CSI, okay? Just like CSI, the show, okay? So C for celiac trunk, okay, which is this one that splits into all these three. So that's a celiac trunk. This one is S for superior mesenteric artery. And then this one down here is I for inferior mesenteric artery. So CSI. Then celiac trunk also goes outwards into the spleen because this area is a spleen. So this one is the splenic artery. And then you have the ones that goes to the kidney. So don't confuse the kidney with the spleen. They are two different organs, okay? So kidney, you have two of them. Spleen, you only have one, okay? And the spleen kind of sits higher than the kidney. And so you see this little artery going from the abdominal aorta into the kidney is the renal artery. And then the one going from the kidney back into the inferior vena cava is the renal vein. And then you have the pulmonary trunk going back to the heart. So here is the pulmonary trunk coming out of the right ventricle, pulmonary trunk coming out of the right ventricle, right ventricle and the pulmonary trunk. And then pulmonary veins is then the red ones coming back into the heart through the left atrium. So these red ones right here or these red ones right here are the pulmonary vein, oxygenated being red coming back from the lungs. Then you have superior vena cava right there, superior vena cava. Then you also have subclavian vein, axillary vein or auxiliary vein. And then you splits into two, okay, where you have the cephalic vein and basilic vein. One is on the outside, one is on the inside, okay? Cephalic is the one on the outside. The basilic is the one on the inside. Now, don't confuse it with basilar artery within the skull. And then you have this one right here, further down the arm, which is the median cubital vein. And this bright, big blue one coming down from the heart is the inferior vena cava, okay? Inferior vena cava. And from the inferior vena cava, you have one branching off into the liver. This one right here is the hepatic vein, where blood from the liver goes back into the inferior vena cava and goes back to the right atrium of the heart. Then you have the renal vein that I already talked about, okay? Now on to the lower portion of the model down here. So from the inferior vena cava, it then splits into the blue right here, or the abdominal aorta that splits into the red, okay? So this one is the common iliac artery before the little splits right there. Common iliac artery, common iliac vein. And then when the common splits, you have the external iliac artery, internal iliac artery right there, that little one. Same thing for this side, internal iliac artery, external iliac artery. And then you have right here, femoral artery, popliteal artery, which is right behind the knees. And then you have the posterior tibial artery and the anterior tibial artery, either anterior to the tibia or in back of the tibia. And then you have your vein. I already said that these are your common iliac vein before the split. And then you have your external iliac vein or internal iliac vein. Same thing there, internal iliac or external iliac vein. Then you have your femoral vein, which is right there, okay? This one, femoral vein, not this one. This one is part of a very long vein that goes all the way down to your feet. This one is called the great saphenous vein. The great saphenous vein. And this one is then the femoral vein, right in the thigh area. And that is all for this particular model.